viewers, and welcome back to our today's discussion. Today we are going to talk about pelvic inflammatory disease. My name is Dr. Mohamed Noah Senso. Thank you for having time with me. Now let us ask ourselves, what is pelvic inflammatory disease? Pelvic inflammatory disease, these are a group of diseases which affect normally the genital tract. In other words, the reproductive part of the women. Okay. Now, considering the fact that women have got their reproductive organ, the main part which is being affected is the genital. The main part which is being affected is the reproductive system. Now, the reproductive system again is divided into parts. But when we talk about the pelvic inflammatory disease, the most part which is going to be affected is the cervix. There are a number of organisms which affect the cervix. Okay, the part of the cervix which normally is going to be affected, one, we have what we call the ectocervix. That is the outer part of the cervix. And again, if the disease enters into the cervix, the inner part, which is known as endocervix. Okay, now there are common organisms which affect the outer part of the cervix, and these are, one is trichomoniasis. This is the type of disease which will affect normally the outer part. Think of the candidiasis. Again, the candidiasis is going to affect the outer part. Now, once this disease set in, is going to lodge in between the ectocervix and the endocervix. Okay, then they will try to ascend more. The diseases which are going to enter and affect the inner part of the cervix, that is the endocervix, the most common organism is chlamydia and gonorrhea. Although gonorrhea is not common, but the commonest organism is chlamydia. Okay, now if this disease ascends from the cervix and enters into the uterus, there will be an inflammation of the lining of the uterus. Okay, now it's going to cause the inflammation. It's going to cause the inflammation of the endometritis. Now, the infection is going to ascend even more and cause tubal infection. The tube are going to be inflamed, and you will find that such a tube, once it has been inflamed, you'll find that it's known as salpingitis. Okay? Now, this disease is even going to ascend even more, and the further increase and movement of this disease, you will find that it's going to affect even the ovaries. And that is a situation whereby the woman will complain of this feeling pain in the lateral part. And such a condition is known as arthritis. Okay? The lining of the pelvic now is going to be even affected more. And we'll find that now there will be formation of the pus pocket in such particular area where the organism have set in, and even the tubes are going to be blocked due to salpingitis. Okay, now the infected tube is going to lead to even infertility, because in the tubes, those are the places where fertilization is going to take place. Now, if this disease has not been contained in time, you'll find that this woman is not going to be to be productive, or rather is not going to get pregnancy. the pregnancy is going to be a problem because the tubes have been affected. Now, coming to PID, that is pelvic inflammatory infection, the whole of the uterus have been inflamed. The inflammation of the uterus, and you must understand that the lining of the uterus is the epithelium. Now, it's mostly the epithelium which is going to be affected and get inflamed. Now, let us ask ourselves, what are some of the causes of PID? The most common organism which affect and cause PID, as I have said, is chlamydia. Chlamydia will enter and ascend and cause the whole of this havoc. Okay? Having understood that, now there is what are the causes of these or the risk factors which will increase the movement of this organism now to the uterus. Think of bacterial vaginosis. Bacterial vaginosis, you must know that there are good microflora. The microflora, which are good organisms which normally protect the entry of organism. Now, if the microflora, that is the lactobacillus, you will find that these are organisms which are positive. There will be imbalance of what we call now this organism, and hence the defense mechanism of now moving, the defensive mechanism is going to reduce. Once it's reduced, this woman is going to be prone to get this particular infection. Now, the ascending movement of bacteria will lead even to now the tubes. The tubes are going to be affected more. However, main cause of the PID, as I've said, is chlamydia. At times, even gonorrhea can cause chlamydia, but we must remember that gonorrhea is not a common organism nowadays. It used to be common in 2 decades ago, but nowadays the leading organism which causes PID is nothing but chlamydia. Okay? 80% of chlamydia are asymptomatic. Asymptomatic in the sense that normally these women, they will be affected with this organism, but they will not have the presenting features. Okay? Now, once this disease enters in asymptomatic state, these women are not going to have the state. But as time goes by, you will find that the chronicity is going to increase. And this time round, these women are going to suffer even more. Now, PID in women who are not sexually active, I mean the virgin, normally we don't talk of the cause being the chlamydia, because chlamydia is a sexual transmitted infection. Now, in case this woman presents with features related or similar to PID, we think of TB, the tuberculosis, because these are women who are not active. That is the virgin girls. They have not involved themselves in sexual intercourse. And if they present with such a scenario, the first diagnosis is going to be, maybe it's going to be tuberculosis of the pelvic region. Okay? In postmenopausal women, again, if they present with features of pelvic inflammatory diseases, again, here we are going to think of the most common organism to these women is E. coli. Now, as medical doctors, we must now able to differentiate even which organism causes PID. Now, What are the presenting features of PID? These women will normally come to our facility by the complaint of pelvic pain. Now, it will depend with the severity of this kind of a disease. Others are going to talk of excessive pain, intense pain. Okay? Others are going to talk of complain of a dull pain. Since these organisms are microorganisms in nature, again, these women are going to complain of fever. Okay? Now, others are going to complain of difficulty in urinating, that is dysuria. Okay? There are others who are going to complain of excessive vaginal discharge. Now, excessive vaginal discharge in the sense that they will be coming out from the genital tract. Others, they are going to complain of excessive bleeding. Okay? Excessive bleeding, the other cause might be use of family planning, but normally if combined symptoms, think of pelvic pain, fever, this woman has got painful in urination or pain during sex, and again at the same time complaining of excessive bleeding, you're going to think along the issues of pelvic inflammatory disease. Now, the treatment of this particular disease is based on clinical features. The above symptoms of pain, fever, difficult in urinating, painful during sex, or painful during sexual intercourse, those are the features that you will now, those are the features which will be leading you to making a diagnosis of pelvic inflammatory disease. Now, you must satisfy yourself of the above symptoms. Now, you have to do what is known as pelvic examination. For you now to be satisfied, now the pelvic inflammatory disease you're talking about, is it now relating with what you're thinking? Now you'll do the pelvic examination, and at the same time you'll do vaginal examination. Now, in physical examination, when we talk of physical examination, is how do these patients present physically. Now, if you do what is known as cervical motion, you'll find that the cervical motion, when you move the cervix, this woman is going to complain of pain, tenderness. Pain, when you talk of pain, this is where you insert pain into this particular part. Think of uterine tenderness. This patient, again, within the uterine, there will be very painful situation. Okay? Now, at the same time, if you open the cervix, there will be some discharge which are oozing from the external os. Again, that one will help you to make the diagnosis. Now, the greatest organism that will come always to your mind is chlamydia. Then you will take now the sample to confirm whether it's chlamydia or gonorrhea. Okay? Now, once you've seen the cervix at your exposure by the use of speculum, you will realize that now the outlook of the cervix has got some erosion. There's some bleeding which is going on. The healthy cervix is not normal. Then you'll have a diagnosis of possible pelvic inflammatory disease. Now, this patient with the PID normally will present with infertility, inability of getting children. And you must understand that if this woman is active sexual intercourse, again you'll understand that now he has this. Some of the questions that you're going to ask, you'll ask, has he been able to get the children earlier before this? Another question is that, is this woman able to have is there a history of having children? Now you'll be able to know the secondary infertility and primary infertility. Okay, now having said that, pelvic inflammatory disease is a combination of infection. Now you're going to combine antibacteria for treatment to be effective. Having said that, welcome, and let us see and hear your views. Thank you very much.